Okay, let's start into this afternoon session, which is still the session Society. It's my pleasure to introduce Dr. Max Wolff, who also gave a talk at the opening on Thursday night. Dr. Wolff is affiliated with the Mind Foundation and with the Charité. He's a psychologist, and he will talk psychologist and psychotherapist and also therapist in the episode trial. And this afternoon, he will talk about measuring psychotherapeutic processes in the context of psychedelic experiences, validation of the general change mechanisms questionnaire. Max, please.
Thank you very much, Gerd. So just to get an impression of how much I need to explain, how many of you have seen my talk on Thursday? A lot. Okay, great. Thanks for coming again for this. So general change mechanisms, I presented this on Friday. This is a concept from empirical psychotherapy research proposed by the psychotherapy researcher Klaus Grawe. These are supposed to be 5 general change mechanisms of psychotherapy that underlie the efficacy of all effective psychotherapies. Even though these may use different methods, they all are supposed to tap on these general change mechanisms. We use this model in our APT program as a theoretical basis of this program because it seems to really work very well with not only other psychotherapy, but also psychedelic therapy. And it's also very practically useful for translating knowledge from psychotherapy research to the practice of psychedelic therapy. I think I will not explain the individual change mechanisms now, because you've already heard about them. I will also show the items of the questionnaire later that will give you more of an idea of what is meant by these. The general question here is, are these general change mechanisms actually also active in psychedelic therapy? And if so, how do they look like? How do they manifest, especially in or during psychedelic experiences of patients? Or perhaps also more generally, not only in clinical context, but also more generally in naturalistic psychedelic use. Yeah, so far there's hardly any exchange between psychotherapy research and psychedelic research. That has historical reasons, and I believe there is a lot to win from bridging that gap and connecting these dots. We don't have to reinvent the wheel with psychedelic therapy. We just need to start using the same constructs in research. Existing questionnaires to measure GCM, there are, of course, existing measures, but these are not suited for application in psychedelic therapy because they very often refer to therapist actions. Things, for instance, like a resource activation item in a typical questionnaire would be, today my therapist used my strengths in therapy. Yeah? And that works in the talk therapy, that item, but for a psychedelic dosing session where a patient is wearing eye shades and headphones, when they have a resource activating experience, they may not necessarily attribute it to an action of the therapist, right? So we have to detach the formulation of the item from the action of the therapist. So this is why we decided to develop a new questionnaire that's suitable for this form of therapy. And the good thing is we can also apply it after normal therapy sessions. We can use it after a dosing session, we can use it after a preparatory session, we can use it after integration session, and that also already gives you an idea of this connection, right? So this allows us to measure the therapeutic process as a continuous process. We don't use different constructs for the processes that happen in the dosing session, right? So we developed this questionnaire in English and German simultaneously. That also has the advantage that we don't have to translate it and then find out that the items actually are not translatable. So this is a great way of avoiding that. And we did a survey, bilingual survey, among young people, or people of all ages, minimum 23, and they had to have used a psychedelic in the last 5 years. That was the the inclusion criterion. Yeah? So very broad study. And we recruited patients through social media, newsletters, and we asked people to report on a memorable psychedelic experience that they could choose if they had had more than one in the last 5 years. We measured context factors, things like setting and use motives, and then importantly the psychometrics to describe the experience. The general change mechanisms questionnaire, but also some other questionnaires. We also measured current psychological well-being and stressful life events over the past 5 years. I will explain in a bit why we did that. This is the sample. It's a large sample, in the total bilingual sample, almost 1,900 people. Yeah, mostly male people. Men engage in more risky behaviors, such as drug taking, and they talk about it more also. That's why we always see this pattern. They're also mainly educated people. Yeah, that's also something we see in these online surveys. It's a problem in psychedelic research. The experience that people reported on were on average 1 year ago, a bit more than 1 year ago. They're mostly LSD and psilocybin experiences, some ayahuasca, some mescaline. Other psychedelics were not allowed in this survey. Yeah, most people stick to harm reduction recommendations. Yeah, 84% of people chose a calm, undisturbed environment, familiar environments. A lot of people did it in nature. This is especially important for today, setting designed for therapeutic purpose. We don't know what that exactly means when people say that, but it could be a study, it could be underground therapy, it could be an ayahuasca ceremony with a therapeutic framing. Yeah, then there's also, of course, party, concert, festival use, and so on. Yeah, most people say that these experiences were either at least rather pleasant or pleasant and unpleasant. Very few people report only unpleasant experiences. This is also a problem in psychedelic research. If you had a very unpleasant experience that's only unpleasant, you're probably not going to want to report about it. Yeah. And most people, that's another problem, but it could also represent a reality that most people report very positive or positive experiences. I think a lot of people actually have positive experiences, but we also should acknowledge that there's probably more people who have negative or very negative experience, but they just don't like talking about them that much. Yeah, so let's just look at the items of the questionnaire. This is already the factor analysis for the first factor. These are just the items that were selected eventually. Resource activation. I could see myself in a positive light. I became aware of things that I'm thankful for. Felt connected to things that give my life meaning. Felt in contact with my strengths. Became aware of beautiful things in my life. So these are all, can be thought of as resources very broadly. Second one, problem actuation. I relived painful or fearful memories. I experienced feelings that I previously avoided. I was confronted with my problems. I could feel that my vulnerable spots were being touched upon. Felt emotions that are related to my problems. So what you can see here is there's no reference to therapists, right? So these are all just experiences. They could be related to an interaction with a therapist, but they could also come from the inside or be attributed to the substance or to the experience. Or so we don't want to impose that. A correlation. This is a low or weak to moderate correlation, and this is what we would expect also. These can happen relatively independently. Like in psychotherapy, you can have a very resource-activating focus, but you can also have a problem-activating focus. They should actually come together for there to be therapeutic benefit, but they can be independent. And that's what we also see here. Clarification. Gained a new understanding of the difficulties in my life. Became clearer to me why I tend to react in certain ways, certain difficult situations. Could see my problems in a new light and so on. Not going to read them all in order to save time now. Now the correlations, again, this is interesting, and it's also expected. This correlates more strongly with both resource activation and problem activation. That also makes sense from a psychotherapeutic point of view. In order to have clarification experiences, you have to do resource activation and problem actuation. They're both conditions for these kinds of clarification experiences. Mastery. I made progress in coping with my problems. I learned things that can help me handle difficult situations, found new ways to deal with situations that have caused me problems in the past, and so on. Again, the same thing. This also correlates strongly with resource activation and problem actuation. And it correlates also very strongly with clarification. These were still separate factors. The model is very clear on that, but the correlation is so high. I think there are, that's also to be expected, to have not maybe such a high correlation, but a high correlation between those, because mastery often entails clarification and vice versa. Yeah. When you have found ways to deal with difficult feelings or to regulate them better, then you will be able to pay more attention to them and learn something about them. Yeah? And also vice versa. So that can explain the high correlation, and especially given that these are retrospective reports from like a year ago, then people may also sometimes confuse a bit their experiences and their consequences. So that's how I would explain these high correlations. Also, we have an extreme variability in settings and also intentions for use. And that variability also magnifies the correlations, of course. So if you only take from this sample the people who took psychedelics in a therapeutic setting, then the correlations would also go down a bit. Yeah, this is a good model fit, good reliabilities. Yeah, let's look at other psychedelic constructs. Emotional breakthrough. Emotional breakthrough inventory correlated not at all with resource activation. It's not a resource-related process. It's more problem-related. It has to do with facing your demons and overcoming them in a way. Yeah? So this is expected, that there are these relatively strong associations with problem actuation, clarification, mastery, but not resource activation. Oceanic boundlessness. This is more or less the same as a mystical experience, at least statistically. And this is kind of the opposite. So this is a resource-related experience, strongly or moderately to strongly related to resource activation and not so related to the problem aspects of psychotherapy. The challenging experience questionnaire. That's again to be expected. Correlates positively with problem actuation and not so much, or actually almost not at all with the others. Correlation is not so high because not all problem actuating experiences are very challenging necessarily, and also not all challenging experiences are actually problem related. You can just have a terrible experience. It doesn't have to do with your problems. Yeah. Now, associations with motives for psychedelic use. We have another questionnaire to measure to measure different kinds of intentions. Therapeutic intentions, that's things like to confront problems, to work on emotional problems, to treat psychological problems. Yeah? This is, of course, strongly positively related to all four. By the way, the fifth one, therapeutic relationship, we didn't measure here because it's a naturalistic survey. We tried to, and we have something in the paper about it, but it would be too complicated for now. So I leave it out here. Yeah, but strong associations with therapeutic intentions. Hedonic intentions, that's a kind of an approach-motivated psychedelic use. Taking psychedelics for fun, to be with friends, to be in nature, for sexual pleasure, things like that. Yeah? This is more related, a little bit positively related to resource activation and rather negatively related to the other therapeutic processes. So when you take psychedelics for fun, you're not going to have the most therapeutic experiences, obviously. Yeah. The third one, I think, is especially therapeutically relevant, escapist intentions. That's more like an avoidance-motivated psychedelic use. Sorry, is there a question? No. Okay. So this is things like to escape from my problems, to distract myself, out of boredom, things like that. Yeah, and this correlates, or this is negatively associated with resource activation and positively associated with problem actuation. From psychotherapy research, we know that that's a bad combination. Yeah, to have problem actuation without resource activation is not good in therapy. So as therapists, we should identify these kinds of intentions and work on them before sessions. Right? Now the setting designed for therapeutic purpose, of course, again, positively related to all four change mechanisms. This is not a surprise. Festivals, party, negatively related, also maybe not such a big surprise. Now this I find really interesting. Nature or close to nature environments, positively associated with resource activation and negatively associated with problem actuation. From psychotherapy research, we know that the most successful therapies are the ones that start with resource activation and where you don't start with the problems. Yeah. That's true on a whole therapy level, but also on an individual session level. It's good to start a session with emphasizing the patient's strengths and with bringing positive emotions into the room. And on the basis of that, starting to work on problems. Yeah. So from this, we may take inspiration maybe for future studies where we could maybe, start the first dosing session maybe in nature and then only later sessions in this more introspective, more problem-related setting. Yeah. You could also start a session in nature and then maybe take the headphones and the eye shades on after a while. Yeah. These are just ideas that can be taken from connecting the dots, basically, using psychotherapy research to improve psychedelic therapy. Yeah. Do we have time, Gert? A minute? Yeah. So this last slide here, sorry that it looks really complicated. So we measured stressful life events. That's just a count of a list of 50 or so stressful life events over the last 5 years. And we measured how that relates to current well-being. And then we also measured how the general change mechanisms relate to current well-being. And we looked at the interaction. Yeah. And here with resource activation, we find a very strong main effect of resource activation. The vertical distance here between between all those graphs, it means resource activation has a strong effect, apparently. Although we have to be careful, this is retrospective, yeah? We should not infer causality. But people who report resource activating experiences are much better in terms of well-being. And there's also negative effect of stressful life events. So people who have more stressful life events, they tend to have lower psychological well-being in general. Now, the interesting thing here is the interaction effect. Yeah? That's the kind of the spreading, the fanning out of the graphs here. So for someone, let's look at the top line here. For someone with a strongly resource activating experience, or for people with strongly resource activating experiences, the stressful life events don't have such an impact. Yeah? Careful with causal language or interpretation. And people who have very non-resource activating experiences, for them it's really this strong negative effect. So when we interpret this causally, which we should confirm more in prospective studies, this could mean that resource activating experiences may make people more resilient, for instance. Yeah? But yeah, this is just one possibility of interpreting this. But in a retrospective survey, these kinds of analyses are the ones you can do in order to maybe find some evidence or some indication of longer term effects. This is the way we decided to do it here. Yeah, the summary already. So we developed this new questionnaire. We confirmed the factor structure. The correlations are as expected. I think it's important to notice that this is also evidence that really psychotherapy-like experiences also occur in contexts that are not psychotherapy related, right? Naturalistic use. But they're still context dependent, yeah? Therapeutic motives, therapeutic settings, and so on. We confirmed also expected associations with psychedelic constructs and this possible effect on resilience. Yeah, the main message here is if we have, again, appropriate measurement instruments to capture constructs from psychotherapy research, we can use that to make the knowledge from psychotherapy research applicable to psychedelic therapy. So this instrument really, it is for psychedelic researchers who want to use this knowledge and to translate this knowledge and to connect the fields, that belong together. Yeah, of course, I said it many times, this is a retrospective cross-sectional design. We shouldn't imply or infer causality. And it's also a non-clinical sample. We will use this in future clinical studies, also to validate the missing therapeutic relationship scale. And of course, we always have selection effects with these kinds of surveys. The people who enjoy doing these surveys, they're probably not representative of all psychedelic users. Yeah, these are the great people who helped me with this. And I want to thank them for making this possible, and thank you for your attention.
Thank you, Max. We have time for questions. Chris, please. Has anybody here a microphone? Oh, okay. Is it on?
All right, thanks, Max. Very interesting. I was curious about the omission of psychological insight from your list of psychedelic constructs. So I wondered why you chose not to look at that, or whether you did look at it and didn't find anything.
Oh, actually, so we didn't have one of the insight-specific scales. I mean, if you look at it, the clarification scale of the APEC itself is very much about insights, psychological insights. And then the resource activation scale is also in part about insights, but more about insights about positive goals, insights about healthy aspects of oneself, insights about goals and values, stuff like that. There is a scale from Alan Davis at Johns Hopkins that also distinguishes between those two different insights in a way, goals and goals insights and healthy patterns insights, and also more like problem-related, avoidance-related insights. But we didn't include that measure here in this study. Yeah.
Can we move?
I was curious with the associations with the festival setting. It seems like anything can happen in those settings because all of them were, well, moderately correlated.
Yeah, absolutely. That's important to say. I think a lot of people actually do have therapeutic experiences in festivals. This is just a statistic across almost 2,000 people. Compared to the other settings here that were included, this is just a dichotomous predictor here, a yes and no predictor for the 10% of people who in the study said yes to this question. And that yes response was in a regression negatively associated with the change mechanisms. That just means that this is a relatively unconducive setting to therapeutic experiences compared to therapeutic settings or nature settings. But that doesn't mean that these settings cannot be therapeutic or psychotherapeutic even. Yeah.
Thanks, Max. Great to see this research and this instrument coming out. I was just curious about something more technical to do with why it seemed that clarification and mastery, I suppose, loaded separately onto two different factors, but were so highly correlated. How does that work out?
Yeah, so you want to know why they're separable statistically. So when you do another model, this is a confirmatory factor analysis. So what you do with CFA is usually you compare the complex model. In this case, this is a more complex model with 4 factors to simpler models. And one of the models we also tested here is a model where all the 10 items from clarification and mastery load on the same factor. And that model also has a good fit, but it's significantly worse than this model. And that's how you discern in this kind of analysis that they're still separable statistically. And as I said, when you go to more therapeutic settings, when you reduce the this huge variability in intentions and settings, then the strong correlation also goes down a bit. And I would also expect that when you would use this in therapy, like let's say on the evening after a dosing session and not a year after, you would probably even find a little bit lower correlation. But they will always be highly correlated because that's how these processes work together. Yeah.
Hi, Max.
Hey.
I would like to ask you if you could also filter out if there was some repetition as a factor, because, resources, activation, problem activation. Could be also term in time, right? How many times you repeat such, sessions or whatever. Could you kind of filter it out?
So everybody here only reported on one experience, right? So we don't know, yeah? I would expect, or let's say in future psychedelic psychotherapy research, I would like to use this questionnaire after every dosing session, but also maybe after, maybe not every, but after some of the normal therapy sessions. Yeah? And my prediction would be that in a therapeutic process that is effective in terms, that is, for instance, resource activating, and that is problem actuating, then you will also find psychedelic experiences that are resource activating and problem actuating. And we expect to find this bidirectional augmentation effect, yeah, which we all know probably or believe to know from therapeutic clinical experience, but we want to make it observable. And I think it's much harder to test this with the instruments that we have, like mystical type experience, because those are not things that we really expect to happen in normal therapy sessions. Yeah. So with this, we can try to do that. And another thing that I want to say is probably sometimes we will find, with this we can also see effects of, for instance, clarification. I would not necessarily expect the clarification scores to be highest on the dosing day, but maybe on the following day or the week after dosing sessions. So we can really understand the whole thing as a continuous therapeutic process rather than this separated thing, psychedelic session and psychological component. Yeah.
There was one question here before.
Max, I wanted to ask you. Oh, sorry.
Thank you so much. Thank you for the talk. I get curious when you say that psychotherapy research should inform these processes, because there's still so much ongoing debate about the best support models for psychedelic sessions. And I wonder if you also see any pitfalls by letting regular psychotherapy research inform support models for psychedelic sessions.
Well, I'm not saying that we should exclude certain models, or I think these are two questions actually. One in terms of the models that we use for therapy. I think we can try all models, but it would be nice to actually characterize what happens with instruments like that. And in terms of the measurement, I'm also not saying we should not use the MEQ or other instruments, but it's really important that we learn to connect them or to understand how they associate with more kind of mundane psychotherapeutic processes. Yeah.
I wanted to ask you about the process of preparation and integration, and asking about whether you would also measure this before dosing.
Oh yes, absolutely. So I believe resource activation is super important for every psychotherapy, and especially, of course, for psychedelic preparatory sessions. Yeah. If you look at the standard interventions, intention setting, that is a resource activating intervention when it's done well. Yeah, when you don't let the patient get away with a avoidance motivated intention. Yeah, then it's an actual resource activating intervention. And many of the other things are also resource activating. The way you shape the therapeutic relationship for the patient to experience themselves as a competent, likable person. Yeah? All of that is resource activation. Yeah? Of course, we have to do that in preparatory sessions, and we should also measure it. Yeah.
We have to thank you, Max, again.